To this story now, the death toll during this initiation season in the Eastern Cape is rising. Health Minister Zweli Mkhize says 23 boys have died, mostly from dehydration. The Minister is in our Pretoria studio. He joins us now live. So, Minister, the customary Male Initiation Practice Act became effective in December 2016, but in December 2019, I'm speaking to you about 23 boys dying. Is this act actually working?
Well, the deaths are completely preventable and they are very unfortunate. We really have to indicate our disdain at the fact that we still have the numbers of deaths as they are going to rise. Yesterday I was there, the number was 21, today is 23. And the issue is that the deaths are completely preventable. The bulk of those who die are as a result of the dehydration, because there is some belief that initiates should not be given water, and therefore they end up with dehydration, with electrolyte imbalance, with mental disturbances, and then hallucinations and so on. This is a problem, and some complicate to having renal diseases or acute renal failure, and the other lot die from pre-existing diseases such as diabetes and others, like the one who died in Frontier Hospital died of a known previously diagnosed congenital heart disease, and someone colluded to get him into the initiation center when he should not have been. So we have been visiting to try and find ways to solve this and stop the problem.
Now, Minister, your disdain about these deaths simply isn't good enough. This act includes a jail sentence of up to 25 years for anyone found guilty of breaking initiation laws, but no one has been convicted in the Eastern Cape to date.
Well, if you get to the scene, you'll understand that you might say it's not good enough, but the complexity of the stigma associated with people giving evidence and giving information about who committed the crime is huge. We had a report from traditional leaders, we have a report from the police, the prosecution agencies. They will take the initial report, and then when they go for the statements, the witnesses are reluctant to divulge the identity of other Ingribi or Ikankata who was responsible. The members of family tend to be involved in the aftercare since the surgical excisions. So as a result, the police can't take the investigations further because no one comes forth with the evidence. And once the initiates are healed, they also do not want to come back to deal with the issues in court where they've already been healed. And the code of the initiation center is that what happens in the bush stays in the bush, and so that tends to be the problem. So we are actually working very hard now. There is a huge shift in the attitude of the society, but I was in some of the centers. You hear from the songs, from the way the issue of avoiding cooperating with the hospitals is ingrained, because it's a whole history of a custom that survived for many years on experience of father to son and brother to brother kind of thing.
Yeah. So let's talk about the involvement and role of families that actually send their children to illegal initiation schools that don't meet the current criteria. If their children actually die at these initiation schools, what action can you take against them? Because ultimately, they have put their sons' lives at risk.
Well, it's not only the families. Some of the members of society would also look at a loophole in the legislation and then take up legal defense for themselves, and therefore makes it difficult to implement the legislation as it stands. So what we have agreed to do is to use a combination of review of the legislation to tighten it up, but also to look at regulations where we make proclamations that will force those who are around the initiate to participate in explaining what their roles were. obviously you need a huge amount of cooperation from the community. But one of the things that we have agreed with the traditional leaders is the fact that the issue of restraining, of restricting water for the initiates needs to stop. So we're going out there to supply the water, but we're also sending compulsory teams for inspections, which are medical doctors who will go and rescue some of them out of those schools. But what you need to understand as well is that we do pre-initiation screening where we want to make sure that the person is fit for initiation. But once there is a complication, we need to get them to cooperate, to bring the people to medical attention. And this is what we are focusing on. And we're changing now to ensure that the initiation must take place in winter, particularly for the hot areas, so that the temperatures don't compromise the lives of people, because they seem to be a big factor as well.
Yeah. So you say boys are dying mostly due to dehydration, and you also say that initiation schools should only operate in winter to avoid that. But that doesn't deal with the problem of botched circumcisions and of obviously ultimately death.
That is true. The issue is the communities around are not very keen to participate in male medical circumcision. They will not take it. Instead, they will actually, take someone who's gone through male medical circumcision and take him back to the initiation school, and that's where you get mutilations, excessive skin removal, and all of this. Now, we have to work very hard on creating a positive attitude on this community, starting with the initiates, with the traditional surgeons in Makankata. But the issue which is eluding the traditional leader is the fact that every family just about looks after their own, and therefore there's no standardized way of treating. And so when something goes wrong, then you need to intervene. So what we're then saying is that all the initiation centers must be centralized under a traditional leader, and that we must register all Ingcibi and Amakankata, both with COGTA and traditional leaders, as well as with the Department of Health, so that we can intervene immediately. There must be no initiation school that is away from an accessible area. We must be able to get the community leaders, the men in the area, to go in there and inspect and intervene when there is need to do so.
You know, Minister, we've heard so many other previous ministers talk about these plans to try to make this work and get traditional healers, etc., to work with government on getting this right. But we failed time and time again. What makes you think your efforts are going to be any different?
Well, I think maybe, even the reporters need to go into the area and understand the very wide difference between the way we understand what needs to be done and how the community practice this tradition. It is an issue of having to work hard to change the attitudes. Just to give you an example, the one child, the one initiate that died 2 days ago, went to 3 centers where they were declined. They were told that they were not suitable for circumcision. And then what the parents did, they actually went and brought the healthier brother to get certified, and then they falsified the document and sent the same one back to the initiation. That's the nature of the peer pressure that there is.
So what action are you taking against that family?
Of course, we have to take the doctor who did the doctor or the clinic that certified that they didn't do their work. We have to actually report them and take a strict action on them. We've got the police docket open. The prosecutors are on it. The police are on it. We must take the matter forward. But all of this, that's not the only one. In some of the areas, you have people who have come from other areas. They simply get stamped forms, and therefore we think that they may not have been examined. We report all of those. They must actually be acted upon. So all of these things are about understanding the very wide gap between how we understand that needs to be done and how the community understands the custom, and how to get people to cooperate to give us the evidence we need to convict others. Many of the inquest cases have been closed. They are closed because no one comes forth with the evidence. And it's something that we have to work hard, because it's not only just the issue of criminal enforcement of justice system, it's also educating people to say you cannot be part of colluding in causing deaths or causing people to escape when they should be taking responsibility for the loss of life.
And perhaps if there are consequences for the families involved in actually doing things illegally for this to happen, then you might see some results going forward. What do you think about that?
That's our view. That's our view. The view is that we need to make sure that there are few examples made of those who end up causing the damage. And in this case, we have seen terrible things. I've been into the wards. It's most distressing when you see the level of mutilation, the amputation of penis, and some of the complications. But at the end of the day, I am satisfied that the traditional leaders have actually moved a long way from preaching the tradition as used to be practicing many years ago to actually cooperate with the processes now. We're going to increase supervision, but we need to make sure that once we centralize, we must then act very hard on those who don't cooperate. But the cooperation of the community is important. Reason number one for the poor convictions and inquest close is lack of cooperation. You can't force anyone to give evidence. You have to actually persuade them to do so. That's the weakness of the system.
How can you be satisfied with what's happening? Because I'm looking at a chart of deaths regarding legal initiates, and they've grown and declined over the past couple of years, but not to a point where we're not seeing people actually die in these initiation schools.
The point is that there are preventable factors that we should deal with immediately. Then there are hard issues which we have to face. The easier things to deal with is to actually enforce the rehydration and also stamp out on any activities that are unhygienic, and then also ensure that whoever does any operation or nurses the wounds must be registered and be known, and if they are not, we then need to stamp in at that kind of level. This is possible with the cooperation of traditional leaders when we centralize all of these centers. So we're going to be working on that. So the Premier, who has also taken a very keen interest in fighting this issue, and the MECs will be convening a meeting at the beginning of the year to lay the law down to say no more summer schools. But of course, we need to work with the Department of Education, because if the holidays are too short, it then affects this. Yeah. So we need to do a lot of other work on the side. So all of these things need to be put in a row. But I think we need to understand that this custom is ingrained in the people from generation to generation. So some of the habits are very difficult to uproot, even though they understand, but people are keener to accept the death of a relative than to collude with the arrest of someone who's made a mistake.
Health Minister Zweli Mkhize, thank you so much for your time. We appreciate it.